The evidence was piling up for years, but nothing was done. Hospital managers, police, even those responsible for keeping an eye on doctors, all failed to act. The result? More than 450 patients' lives shortened while staying at Gosport Memorial Hospital.
The events at Gosport Memorial Hospital were tragic, they are deeply troubling, and they brought unimaginable heartache to the families concerned, but they are a matter of which we should be concerned across this House. And he raises an issue about the way in which the public sector often, in his terms, closes ranks. I think this is one of the issues that we need to deal with across the public sector.
This isn't the first time the system has failed victims. The deaths of babies at Bristol Royal Infirmary in the late 1980s was meant to have heralded wider reform of the NHS. A decade or so later, a tragic systems failure allowed Harold Shipman's crimes to go undetected. The deaths of 11 babies and one mother at Furness General in Cumbria uncovered a culture of denial, collusion and incompetence.
This awful culture of ordinary people getting ignored, and it's a culture which sometimes pervades public services, and it has to change.
An investigation was first launched by the police after the deaths of 92 people in the late 1990s. No charges were brought, but inquests held in 2009 and 2013 found that medication prescribed by Dr. Barton had contributed to the deaths of 6 patients. An investigation by the General Medical Council ruled in 2009 that Dr. Barton had overprescribed pain-killing opiates to a number of her patients. She was found guilty of professional misconduct, but not struck off. A review by Richard Baker of the University of Leicester was damning, citing the improper use of painkillers. But the Department of Health refused to publish that report until 2013, 10 years later.
It's a pattern that we've seen too often before, and it's a pattern that's probably related to how we manage things like healthcare, the services like healthcare, where there's anxiety about facing up to problems, defensiveness.
The General Medical Council said today that it will identify ways it can learn from this, and the Crown Prosecution Service says it's considering the contents of the report. But for the relatives of those who died at Gosport, this isn't the end of the story.
As victims of crime, we are all entitled to have an explanation when an alleged injustice has occurred. But this has been sinister, calculated, and those implicated must now face the full rigour of the criminal justice system.
What's not clear is the intentions of Dr. Barton. Many in her hometown described her as a caring doctor. It may still be decided whether these were acts of mercy towards sick patients or malice.